I'm an assistant professor of disaster and emergency management at York University. We have a whole program that is dedicated to studying these kinds of events. And so the coronavirus is a perfect place to explore some of those themes. I think if we've seen anything during the first part of this pandemic, it's that social science is just as important as other kinds of science in helping us address and ultimately resolve this. So if you think about your day-to-day experience with the coronavirus, most of the tools that we have right now are social tools, right? They're getting people to change behaviors. They're getting people to take precautions. Things like getting me to wash my hands regularly, avoid touching my face, stay home. And so it's critically important that we invest in vaccine research. It's critically important that we do a lot of the genomic work around this disease. It's critically important that we look at how different communities are affected at a biomedical level. But those things have to be complemented by these social dimensions, right? The interventions that we have right now are ultimately social interventions. And when we look at the duration of the crisis that may be ahead of us, right, we're going to need a lot of those social interventions to continue while we work on the medical options. To step back for a second and give some context, one of the major parts of our project is to deploy a longitudinal survey across Canada. So this basically means tracking Canadians' beliefs and views and behaviors over time, right? We're trying to see how they change from the beginning of the pandemic to the end, potentially even how they last after the pandemic, and do that monitoring across time so that we can see this variation both within communities and over time. And so getting that first measurement was really critical to get that early during the pandemic. And I have to give kudos to SSHRC and the Tri-Councils here because the speed with which the initial research funding happened was really critical. Another thing that's important to our project is making sure to get this data into the hands of decision makers. So we've been working closely with the Public Health Agency of Canada, with Statistics Canada, and with a number of the provincial and municipal players. Initially, we were working with them to figure out what they wanted to know, right? What are the questions that they care about having information for during this pandemic, and what is the info they need to successfully respond to this? But we've also been feeding back this data to the agencies to help give them the results that can inform decision-making and policy-making over the days, weeks, and months ahead. One of the first things that you learn is that disasters don't respect our disciplines, right? Disasters cross over every possible disciplinary category and every possible field that we work in. And we need all kinds of social scientists, right? We need psychologists who can dig into how this is affecting mental health, and we need sociologists who can explore how this affects our communities. And we need folks from the humanities to make sense of how we can motivate folks and get buy-in, to make sense of how we're understanding this pandemic. And so when we have those complementary perspectives, we're able to solve and to address this crisis in a much more meaningful and sustainable way, particularly when we're looking at a challenge that's going to continue on for an extended period of time with some really adverse consequences. There was also a lot of support for interventions that helped to reduce the severity of the crisis and protect Canadians. So overwhelming, and here we're talking 90% plus of respondents supporting closing schools, supporting closing workplaces, canceling events. These kinds of early interventions to try to slow the spread and flatten the curve were very broadly supported, more so than even some of the interventions that might have to happen if we didn't do those, right? Canadians preferred to try and do the preparedness work versus some of the resulting requirements. So Canadians thought that more Canadians would be affected by the coronavirus than something like the flu, but they thought they were less likely to personally get sick than something like the flu. So they think the risk of COVID is higher, that it will affect more people, but that they are less likely to be impacted. And so that's a really important finding for us and for health agencies to dig into, because the risk here is that if Canadians think this is something that happens to other people and not themselves, it may be trickier to get people bought in on the distancing practices, the hygiene practices, the compliance behaviors that we need to sustain over the long term.